something that affects each and every one of us. It is something that each and every one of us would want to know more about. COVID positive reports are no longer needed to get hospitalized. The government has now announced and said that the national policy for admission of COVID patients to hospitals has been revised to make it more what they're calling patient-centric. So, according to these new guidelines, no patient should be refused services on any count. So what exactly are these new guidelines? Let's go across to Sunil Prabhu. He has all the details. Sunil, this certainly is going to come as huge relief for everyone, because we're hearing horrific stories of people who are going to hospitals and being turned away for the strangest, most absurdist of reasons. What does this mean? What are the new changes? What changes on the ground for somebody who has a loved one that they are trying to get admitted into hospital?
That's right, Sarah. In fact, one of the reasons for why this has come about is because no less than the Delhi High Court had made it clear and compulsory that it should not be, an RT-PCR positive report should not be a requirement. So it's in that backdrop that state after state have now got these guidelines issued by the Ministry of Health and Family Welfare, which becomes a prerequisite. Basically, there's no more requirement and they can be admitted as suspect cases. And most important, which you have been seeing across this country, no patient should be refused on any count admission. And that includes even medications such as oxygen, where we have seen certain deaths taking place, or essential drugs, even if the patient belongs to a different city. And no patient shall be refused permission on the ground that he does not have a valid identity card, because there's many migrant laborers and many people who are suffering and having untold misery, as you rightly pointed out. So a lot of, details have come out with this new national health policy in terms of admission. The big point, of course, and the big question mark is, will this be effectively implemented? One is to have it on paper. The other is to see effective implementation on the ground so that people don't suffer as you hear those horrific stories and we witness it day after day.
All right, Sunil, but it still doesn't solve the problem of a shortage of hospital beds, a shortage of hospitals, a shortage of oxygen cylinders. But yes, certainly a big start. Thanks, Sunil. Thanks for that.